Hello everyone, welcome to this lecture on lymphatic system. I'm Dr. Rayhan Folari, and in today's session we'll be exploring the structure, the function, and the clinical importance of the lymphatic system. Remember, the lecture is a part of an educational series, so be sure to subscribe for more insightful content. So let's get started. Before diving into details, let's establish what we aim to achieve in this lecture. We hope that by the end of this lecture, you should be able to describe the components of the lymphatic system. You should be able to explain how the lymph is circulated and drained. You should be able to discuss the immune functions of the entire lymphatic system. By the end of the lecture, we hope that you'll be able to identify the major lymphoid organs and mention their specific roles. Also, we hope that you would understand the clinical conditions that are related to the lymphatic system. So by the end, you should have a clear understanding of the structure, function, and the clinical significance of the lymphatic system. So keep these objectives in mind as we proceed. So to dive in deeper, by way of introduction, um, the lymphatic system refers to a network of vessels, tissues, and organs that help to maintain the fluid balance and immunity. The system really plays a crucial role in maintaining homeostasis, which is through fluid balance, and it functions as a drainage system, ensuring that excess fluid from the tissues return back to circulation. It additionally is an integral member of the immune system, in that it houses immune cells that fight infections. Another vital function is the absorption of dietary fats via specialized lymphatic vessels, that are called lacteals. So these lacteals they are located in the villi of small intestine, and they collect dietary lipids in the form of chylomicrons and then transport them through the lymphatic vessels, through the lymphatic system before they eventually enter the bloodstream. So let's break this down further in our subsequent slides. Now let's take a closer look at the components of the lymphatic system. Lymph is the main fluid that is transported. So it is a fluid similar to plasma, but without the red blood cell. So it's the main fluid that is transported, carrying waste and immune cells around. So what does this carriage, this vehicular movement, is the lymphatic vessels. So the vessels function similarly to blood vessels, right, guiding the lymph through the entire body. So they transport the lymph. So we also have the lymph nodes, which act as filtration hubs, while specialized organs like the thymus, the spleen, amongst others, perform major immune functions. Okay, so you have the nodes acting as filtering stations, filtering hubs that are packed with immune cells, and then you have lymphoid organs which serve as the source of the lymphoid cells, where they get matured and also get activated for respective immune responses. Let's now talk about how the lymph is circulated through the body. It follows a one-way path, actually, and unlike blood circulation, which is also unidirectional but driven by the heart, the lymph in its own circulation relies entirely on the passive mechanisms such as valves, muscle contraction, and respiratory movement for propulsion. So it starts from the interstitial spaces. It's from the interstitial spaces that you find the blood that has been delivered to the heart being used, that has been delivered to the tissues, being used by the tissues as it came from the heart. So the heart is the major pumping organ for the cardiovascular system. It pushes out oxygenated blood through the arteries into the rest of the body system for them to be used at the level of the tissues through the capillaries. From the capillaries, the blood gets picked up by the venules, and then they go into smaller veins before getting deposited into larger veins and find its way back into the vena cava, the superior and the inferior vena cava, right? This blood that has come back to the heart is deoxygenated blood. That means it lacks oxygen. The oxygen in it has been largely utilized by the body tissue. Now it needs reoxygenation, and now it has come to the heart for that reoxygenation. But the heart does not do reoxygenation. It rather pumps the blood to the site of oxygenation, and that's the lungs. Remember, you inhale and exhale, thereby thereby bringing a lot of oxygen into the body, and then exhaling and eliminating a lot of waste, which largely consists of carbon dioxide. And the blood needs to be oxygenated by receiving the oxygen that has been deposited into the alveoli of the lungs. That's why the heart needs to send the blood to the lungs. This is what is called the pulmonary circulation, or the pulmonary circuit. That is the movement of the blood from the right ventricle after it came into the heart through the right atrium and then enters the right ventricle. It goes to the lungs through the pulmonary arteries for reoxygenation. After it's been oxygenated, it comes back to the heart through the pulmonary veins. This time around, the pulmonary vein is entering into the left atrium and not the right. So it contains oxygenated blood, and then the oxygenated blood then goes into the left ventricle before being pumped back into the rest of the body through the systemic circuit, right? So as the blood is utilized by the tissues from the cardiovascular circuit, the lymph is also working parallel, in the sense that excess fluid, waste fluid that finds their way into the interstitial spaces, okay, get picked up. So they get picked up. That's why we said the lymphatic system commences its circulation from the interstitial spaces. So this is the tissue fluid comes from the tissues into the lymphatic capillaries. So the fluid gets picked up in the lymphatic capillaries and then moves through the vessels and then moves through the nodes as well. So it moves through the vessels, which have valves in them, all right, before reaching the nodes, where it gets filtered. Thereafter, it progresses through the lymphatic trunks, which are found at different locations. So here you find the right jugular trunk, you find as well the right subclavian trunk, right? So the trunks end up converging into larger ducts. So lymphatic ducts, larger lymphatic ducts. It's the ducts that eventually then empty or ultimately drain into the venous circulation via the subclavian veins. So the movement is facilitated by valves and muscle contractions, and it's a unidirectional movement. So that's what we try to. So you see the interstitial fluid goes into the lymphatic capillaries, and then the lymphatic vessels, and then the lymphatic nodes, the lymphatic trunks, lymphatic ducts, and finally it empties into the venous circulation. So by now we understand that the bulk of the lymphatic system consists of a network of channels, which is parallel with the blood vessels, and they drain essentially all parts of the body except the brain, the cartilage, bone, and epithelia. Now, at critical collecting points, you find the lymphatic channels leading into and out of clusters of lymph nodes, which are placed at strategic locations, which we saw in the previous pictures. And due to the vagaries and the differences across the embryological development, the pattern of lymphatic return to the heart is highly asymmetrical. That is, it's not the same for the right and left part of the body. And why do we say that? You can easily tell from this color tagging. This is showing the drainage of the lymphatic of the lymph across the body. So lymphatics from the entire lower half of the body and the left side of the upper half of the body, including the left side of the head and the neck, all drain into the venous circulation, that is the left subclavian vein, through what we call the thoracic duct. So here is a magnification. Remember, this is the right side of the body and this is the left side of the body of an individual that is facing front, right? That is facing the screen. So magnifying here helps you to appreciate here the left subclavian vein. The left subclavian vein, so named because it passes underneath the clavicle, which is known as the collarbone, before it gets joined by another vein called the left internal jugular vein, which then unite on their way to the superior vena cava. So it is the thoracic duct which is seen here. That is the that is the lymphatic vessel that finally empties into the left subclavian vein, right? After draining, having drained the entirety of the body's left head and neck, as well as the left side of the thorax and abdomen, and the entirety of the lower half of the human body. On the other hand, those vessels, lymphatic vessels draining the right upper limb and the right half of the thoracic region, along with the right side of the head and the neck, they enter the right subclavian vein through the right lymphatic duct. So here is the right subclavian vein magnified here. It also gets joined by the right internal jugular vein. Then you see the right lymphatic duct emptying into the right subclavian vein. So with this, we appreciate this drainage, and you see how asymmetrical it is. So by asymmetric, we mean the right is not equal to the left in the way these things are drained. So next, going to the major lymphatic or lymphoid organs now. An organ is considered a lymphoid organ if it's a specialized tissue or an organ where lymphocytes develop and they mature and perhaps become activated before migrating to the peripheral tissues to carry out their immune function. So an organ that does this is referred to as a lymphoid organ. And they are categorized into primary and secondary lymphoid organs. Don't be surprised if you find some text referring to there being a tertiary classification of lymphoid organs, and this is usually referring to the lymph itself, which is the fluid, as well as the lymph vessels. However, we are talking about the organs now, so it suffices to appreciate the primary and the secondary lymphoid organs. The primary lymphoid organs are the site of lymphocyte maturation. So be it B lymphocyte or T lymphocytes, which are types of white blood cells. So the site where they get matured, those are the primary lymphoid organs, and this includes the bone marrow and the thymus. While those other lymphoid organs which act as site for the proliferation and differentiation and activation of already matured lymphocytes are referred to as the secondary lymphoid organs, and these include the spleen, the tonsils, the mold, that is the mucosa-associated lymphoid tissues, the Peyer's patches, all of which will come to in a while. So for the primary lymphoid organs, that's the bone marrow, as well as the thymus, right? They are the site of cell of the lymphocyte maturation. The B cell mature in the bone marrow, while the T cell mature in the thymus. So you may be wondering why lymph nodes are considered lymphoid organs, and that's simply because they contain organized lymphoid tissues where the B and T cells are housed. They also filter lymphatic fluid and trap antigens from infections. They also facilitate adaptive immune responses, including antigen presentation and lymphocyte activation. So now going deeper into each of the organs, we start with the bone marrow. And for the bone marrow, it's a very vital primary lymphoid organ, which is responsible for the production of blood cells, including lymphocytes. It exists in two forms. We have the red bone marrow, which you can appreciate right here. So here's the red bone marrow, and then you have the yellow bone marrow. As for the red bone marrow, it actively produces blood cells, while the yellow bone marrow primarily stores fat, but can be converted back into red marrow if necessary. Okay, so within the bone marrow, you have the B lymphocytes, which are produced and matured before entering into the circulation to perform their respective immune functions. While in contrast, the T lymphocyte originates in the bone, but they migrate to the thymus for further maturation. So this distinction is quite key in understanding adaptive immunity. So you find B lymphocyte being produced and matured in the bone before entering circulation, while the T lymphocyte has to mature in the thymus. Okay, so it only gets produced in the bone, but it goes to it migrates to the thymus for maturation. So the thymus is another primary lymphoid organ, which is essential for the maturation of T lymphocytes that we just mentioned. So it is situated behind the thymus, as you can appreciate here, and it's positioned above the heart. So it's particularly active during childhood, ensuring that there is proper selection of immune cells. So you can appreciate in its anatomy, it is encapsulated by a capsule, right? And then deep to that, you find the cortex, which is separated from each other by the interlobar septum. So deep to the cortex, you have the medulla, and within which you now have the thymic corpuscle. So it's a bilobed pinkish gray organ that is located behind the sternum. So like I mentioned, the thymocytes that are produced here undergo rigorous positive and negative selection, and they eliminate self-reactive T cells to prevent autoimmune diseases. And the thymus also secretes hormones like thymosin, which plays a very crucial role in immune regulation. And interestingly, as we age, the thymus shrinks. So it shrinks and becomes less active, thereby leading to a gradual decline in its immune functions or in its immune efficiency. The lymph nodes now, they act as crucial checkpoints in the immune system. So structurally, the lymph nodes are encapsulated, and you can see the capsule on the exterior here. So they are also being shaped in their anatomy. So they are divided into cortex, medulla, and germinal centers. So you have the cortex on the exterior, then you have the medulla, and then you have the germinal centers deep within them. The outer cortex contains densely packed lymphocytes, which primarily B cells that are organized into follicles, including germinal centers where the B cell proliferation occurs. And then the inner medulla is what consists of the medullary cords and sinuses, as you can see all around this longitudinal section across this cord. So they house the macrophages and plasma cells that help to filter, that do the actual filtering, and then they process the lymph. So you have the reticular fibers network providing structural support and facilitating the immune cell interactions. So the primary functions of the lymph node is to filter harmful substances from the lymph, producing lymphocytes and serving as site of immune responses. There are major groups of lymph nodes across different parts of the body. So you have the ones in the neck region, referred to as the cervical lymph nodes. Then you have the axillary lymph nodes. You have the inguinal lymph nodes. You have as well the mesenteric lymph nodes, each strategically positioned to monitor lymph from different body regions. And when you exercise, when you feel or experience swollen lymph nodes, it often indicates an active immune response to infection. So, and here again is a picture that is further amplifying the cervical lymph nodes and then the axillary lymph nodes, which also receive the lymphatics of the mammary gland. You have the inguinal lymph nodes, you have the lumbar lymph nodes, you have the pelvic lymph nodes, you have the lymphatics of the lower limb. So all of these lymph nodes are strategically placed to take care of the filtration during the circulation of the lymph on its way back to the cardiovascular system or back to the venous drainage system. So now to the spleen, which is the largest secondary lymphoid organ. The lymph is a secondary lymphoid organ because what you have occurring there is the activation and proliferation of already matured lymphocytes. So it acts as a blood filter and as an immune system hub. So it's divided into two main parts. Here's the location of the spleen, and then you have the spleen having the white pulp. That's the first part, and this is the part that contains lymphocytes and participates in the immune responses. But then it also has this encircling red pulp, and the red pulp is responsible for filtering blood and breaking down old red blood cells and recycling iron. So it's very important. And the spleen also plays a crucial role in removing antibody-coated bacteria and foreign particles, making it very essential for fighting infections altogether. And to add to that is that during fetal life, the spleen even contributes to the formation of blood cells. That's what we call hematopoiesis. So the spleen as a secondary lymphoid organ is also very crucial. Next is the tonsils. Tonsils generally serve as first line of defense against airborne and ingested pathogens. They are located at the entrance of both respiratory and uh, and uh, and the digestive tract. So they altogether, these tonsils form what we call the Waldeyer's ring. It is named after Waldeyer, the Heinrich Waldeyer Hartz, who was a German anatomist and pathologist that was the first to describe this circular arrangement of the lymphoid tissues in the pharynx. So the ring-like structure is composed of four main types of tonsils, and all of these four categories of tonsils form a protective immune barrier around the entrance of the digestive and respiratory tracts, as mentioned. So the first is the adenoids, so otherwise known as the pharyngeal tonsils, because they are located at the back of the nasopharynx. So the adenoids, adeno means gland, so adenoid means something that looks like a gland. This is the other name given, or this particularly refer to the pharyngeal tonsils. So they are located at the back of the nasopharynx. And the next category is the tubal, named after the Eustachian tube. Okay, so because they are found around the opening of the Eustachian tube. So these are tubal tonsils, which are quite bilateral, right? And the next category are the palatine tonsils, so located around the palate. So they are found on the front side of the throat. So here you appreciate the palatine tonsils again bilaterally. So palatine tonsil is here on the right and the left. Here is the pharyngeal tonsil, that's the adenoid. And then the tubal tonsil is not readily visible here, it's been obscured. So it's but it's more visible in this sagittal section. So, and then lastly, we have the lingual tonsil, which is named after the tongue, right? Lingual tonsil, it's located here. It's also located here, and that's what you see here as well, also a bilateral structure. So they are located at the base of the tongue. So all of these tonsils, all of these structures help to trap and neutralize inhaled or ingested pathogens. That way it forms the body's first line of defense in the upper respiratory and digestive tracts. And whenever it comes in contact with a pathogen, it initiates an immune response before they are able to even spread to the rest of the body. They usually contain lymphoid follicles for this antigen detection and immune response initiation. Next is what we call the Peyer's patches, named after Johann Peyer in the 17th century, because he was the first to describe these patches. So they are located in the small intestine, particularly in the ileum. Remember, the small intestine is composed of the duodenum, jejunum, and ileum. So you find the Peyer's pouches mostly in the ileum, and these are the pouches. Here, 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 each of these stops. Yeah, so these are the Peyer's pouches. So they are part of what we call the GALT, G-A-L-T, gut-associated lymphoid tissue. So the function is to serve as sentinels like watchman, like the guard, of the intestine. And what they do is to detect pathogens. So whenever they detect pathogens, they generate immune response immediately, and then they help that way to maintain the homeostasis of the gut. And their role in infection, immunity, and vaccination makes them a fascinating subject when it comes to immunity. So a special feature of this Peyer's patches is the presence of what we call the M cells, which sample antigens from the gut lumen and then present them to immune cells. And this function is, of course, critical in maintaining the health and the homeostasis of the biome generally, while protecting against pathogenic bacteria. So all of these the patches are quite specialized in their structure and their function to help monitor the intestinal environment. So our next organ of discussion or tissues of lymphoid tissues of discussion are the mucosa-associated lymphoid tissues known as malt. So if you're the type that likes to take malt drink, you probably wouldn't forget this anytime soon. Mucosa-associated lymphoid tissue. So they represent the largest component of the immune system as they provide defense at the mucosal surfaces across the body, where most pathogens tend to enter the body. So that's why molts are categorized into different subtypes. You find some around the conjunctiva of the eyes, known as the conjunctiva-associated lymphoid tissues, CALT. You also find some others at the nasopharynx, known as the nasal nasopharynx associated lymphoid tissues. Those you find at the bronchial region are given that name, bronchus associated lymphoid tissue. And then you have some at the gut, known as GALT, and then you have some at the urinary tract, which could be referred to as the urogenital associated lymphoid tissue, or vulvovaginal associated lymphoid tissues. So all of these lymphoid tissues they are rich in B and T lymphocytes, as well as in macrophages and dendritic cells, ensuring that there is continuous immune surveillance in the body's mucosal surfaces. So they are very And now we proceed by appreciating the clinical relevancies of the lymphatic system, because disruptions in the lymphatic function can lead to clinical conditions like those that we're about to go into. So let's start with lymphedema and elephantiasis. So as for lymphedema, like the name suggests, edema of lymph, perhaps in the lymphatic vessels and neighboring tissues. So it arises when there is a disruption in the lymphatic flow. It's a type of organic impairment that leads to the buildup of lymphatic fluid. So it is clear, of course, that patients will not behave the same way in terms of the progress and the presentation of their lymphedema. So you have some patients with lymphedema who have few symptoms and can easily do different degrees of physical activities, while you find some other patients who feel strain at the slightest experience of movement, so they easily experience increased swelling with minimum effort, or even suffer varying degrees of disability and severe complications. So here is an example of, so it occurs in stages. So at the first stage is the asymptomatic stage, right, where you have the lymphatic system experiencing abnormal flow, but it is yet to manifest in terms of fluid buildup. So it's asymptomatic, that is, it's not showing any symptom at stage 1 of lymphedema. But by stage 2, you already have some swelling due to accumulation of lymph fluid, which can also subside if the leg or the limb is elevated. So that is at stage 2. But by stage 3, the swelling has become permanent. So you have a permanent swelling that cannot be relieved even if the limb is elevated. So, and this is usually accompanied by changes in skin, known as the fibrosis of the skin. And then this could eventually lead to the 4th stage, where you have lymphostatic elephantiasis, which involves the deformation of the limb, due to extensive swelling and excessive thickening of and scarring of the skin. So across the world, you find people suffering from neglected diseases, which include these. So it prevails in a number of countries, where you have where you lack good healthcare services and medical resources, amongst others. So the thing with lymphedema is it doesn't kill immediately, but instead it slowly becomes severe and disabling, so leading to terrible sufferings and creating losses of functionality in patients. So lymphedema is accumulation of the fluid due to blocked lymphatics. And like we just mentioned, elephantiasis is an advanced uh, lymphedema. So it is characterized by fibrosis and fatty induration of the tissues, which become much more difficult to reduce at later stages than in early stages, where the swelling is more characteristically due to just protein-rich fluid. So in order to reduce the incidence of elephantiasis or get into the elephantiasis stage, more intervention would definitely be required at earlier stage, much more uh, than the later stage. So that's why if a stage 1 lymphedema like this is left untreated, unintervened, then it becomes a stage 2 like this, where you start having the permanent swelling. And if not intervened at this stage as well, is what will end up leading to the advanced stage, which becomes the elephantiasis. So it's caused by impaired lymphatic drainage, which can be managed through what is called the compression therapy. Also, it can be treated by manual lymphatic drainage, which is a specialized massage technique that is used to improve flow of blood. Exercise has also been recommended, and then skincare, for the external cosmetics of the skin. But in severe cases, procedures like surgical interventions, like lymphatic bypass or lymph node transplantation may end up being required to keep the patient healthy. Other lymphatic disorders could be lymphadenopathy, which refers to enlargement of lymph nodes, often due to infections or autoimmune diseases or malignancies. So it can be localized, affecting nodes in specific regions, such as the nodes you find in the anterior portion of the ear, as a preauricular, or the lymph you find at the posterior part of the hair, posterior to the ear region, known as the posterior auricular. You find some close to the nape of the head, known as the occipital lymph nodes, the ones beneath the, here they are called the submaxillary. So the submaxillary lymph nodes or the submental lymph nodes. You also find the posterior cervical in the cervical region on the posterior aspect. You also have the deep cervical chain of lymph nodes. So any of these localized lymph nodes could have been affected individually. So, and it could also be a generalized one involving multiple areas simultaneously. And it could be caused by bacterial or viral infections or immune disorders and cancers like lymphoma. So when you find tender mobile nodes, it usually suggests infection if it's soft and tender. So, but if it is hard and it's looking fixed, so such nodes may indicate malignancy. So understanding the lymph node changes is usually crucial for diagnosis and for identifying the underlying condition. So it's managed with a number of ways depending on the underlying cause, if it's been identified. So if it's infection, antibiotics or antiviral therapies could be a way out, while autoimmune conditions may also be suppressed, may be treated using immunosuppressants. But if malignancy is suspected, which is tending towards a cancerous condition, so that usually requires further diagnostic tests such as biopsy or imaging, before then providing treatment like chemotherapy, radiation, or even surgery. Lastly, cancer of the lymphoid tissue is known as lymphoma. So, and it's also a type of blood cancer, that originates in the lymphatic system, affecting the lymphocytes. So, it is classified into Hodgkin and non-Hodgkin lymphoma. So, based on the distinct cellular and histological features that you find between them. So, as for Hodgkin's lymphoma, it is characterized by the presence of what we call the Reed-Sternberg cells, which are these large abnormal B lymphocytes with multiple nuclei that are seen upon histological examination. So for Hodgkin lymphoma, it typically follows a contiguous pattern of spread from one lymph node to the next, from one lymph node to the next. Okay, so it follows that contiguous pattern from one lymph node group to another during its metastasis. While for the non-Hodgkin, you don't find the Reed-Sternberg's cells in them. So it on its own, in its own case, it includes a diverse group of lymphoid malignancies, often involving B and T lymphocytes without the Reed-Sternberg cells. In this case, it's not contiguous. It doesn't follow a contiguous pattern like with the Hodgkin that has the Reed-Sternberg. So for this reason, it spreads and has a more variable histology, ranging, from indolent to the aggressive forms. So it has a number of both the Hodgkin and non-Hodgkin present with persistent swollen lymph nodes, which can be painless in most cases. It could also come with fever, night sweats, fatigue, itching, and the treatment usually depends on the type and stage of the lymphoma. Even though the common therapies are always chemotherapy, radiotherapy, immunotherapy, targeted therapy, which seeks to block specific molecular pathways, including pathways that are involved in the cancer projection. Stem cell transplant has also been considered in treating a number of patients. But in all, early diagnosis and tailored treatment plans is what significantly improves the prognosis. But the thing is, Hodgkin lymphoma generally has a higher cure rate, the one with the Reed-Sternberg cells, while the non-Hodgkin is usually having a poorer prognosis, as contained in this comparison we have in this next slide. So the prognosis for the Hodgkin lymphoma is usually good, while it's worse for the non-Hodgkin lymphoma. So you can study this chart further for further comparison between the Hodgkin and the non-Hodgkin lymphoma, So based on the etiology and the epidemiology, in Hodgkin lymphoma, for example, it primarily affects young adults and older adults from 50 to 70, and young adults between 20 and 30 years. So while for non-Hodgkin, it's more common in older adults, with peak incidence being above 50 years. As regards etiology, both types have association with infections and immune dysfunction. So that's why for Hodgkin lymphoma, immunosuppression is a cause. You also have the Epstein-Barr virus, the EBV, Epstein-Barr virus infection, and then autoimmune diseases. In the case of non-Hodgkin lymphoma, it could be caused by HIV as well, the Epstein-Barr virus, the human T-cell leukemia virus, that's the HTLV1, and hepatitis C, Helicobacter pylori, amongst others. So there are quite a number of variations between them in terms of etiology, the clinical features, the leukemic phase, the Reed-Sternberg cell, amongst others. So to summarize, we now appreciate that the lymphatic system maintains the fluid balance and supports immunity. We've gone through the different components of the lymphatic system, ranging from the lymph itself down to the vessels and the nodes and the trunks, the ducts, before they eventually enter the bloodstream. We've understood the different lymph organs, the primary lymphoid organs, the secondary lymphoid organs, and if you wish, you could also have the tertiary lymphoid organs, which would be referring to the lymph itself and the other lymph vessels, right? So we've gone through the primary lymphoid organs, which are majorly the thymus and the blood and the bone marrow. You see it's coded here in blue. And then the secondary lymphoid organs include the spleen, the tonsils, the nodes, the Peyer's pouch, the Peyer's patches, the mold, mucosa-associated lymphoid tissues, amongst others. So we've also highlighted some clinical disorders that could arise from the obstruction, infection, or malignancy of the lymphoid tissue. So we agree that the lymphoid system, lymphatic system, is vital for maintaining fluid homeostasis and immune defense. And to understand its pathways and functions definitely help in diagnosing and managing lymphatic disorders. So to test how well you've understood this, you may try answering some of these questions by dropping your responses in the comment section. What are the main functions of the lymphatic system? Are you now able to describe the flow of lymph from tissues down to the venous circulation? Are you able to differentiate between the primary and secondary lymphoid organs? And what are some of the clinical conditions that are affecting the lymphatic system? You may also feel free to check the video again to verify some of your answers, and also reinforce your knowledge. So that's going to be it for today. Thank you very much for watching, and be sure to drop your comment and also subscribe for more content on this channel. See you next lecture, and I wish you all the very best. Bye from here.